This is the final project for Biomedical Informatics Course 6010, Foundations of Biomedical Informatics. We are Group 3, John Bramble, Ben Clyde, Vanessa Des Azevedo, David Hadley, Jennifer Murphy, and Sarah Wawinski. We are going to discuss many aspects of info buttons in this presentation. This is for fall semester 2017. In this presentation, we will cover a number of topics related to info buttons. First, we'll talk about the origins and how they were invented. Next, we'll talk about how info buttons work. Then, we'll discuss the clinical applications of info buttons. Following that, we'll talk about evidence-based medicine and how info buttons help improve clinical outcomes. That will be followed by barriers to wide clinical adoption, or what are the challenges with info buttons currently. We'll then talk about the next wave, which is creating info buttons for patient-facing applications. And then we'll hear from Dr. Del Fiol, who is a subject matter expert on info buttons, who invented the Open Info Button platform. Lastly, we'll talk about this group's conclusions for info buttons.
The likely origins of info buttons stems from a 1985 seminal study reporting that the information needs of physicians are often unmet. This report found that for every 3 outpatients seen, physicians raised 2 questions. 70% of these questions went unanswered. 20 years later, a 2005 study reported little change from Covell's finding. The Ely study found that 45% of questions raised by physicians went unanswered. When looking at the remaining 55%, they found that 28% of these questions raised went unanswered. 9 years later, Dr. Fiol reported that physicians continue to have questions go unanswered. From his 2014 systematic review, he found that for every 20 patients seen in a given day, there are 12 clinical questions raised. 6 of these were pursued, 4 were answered, and 2 went unanswered.
The way info buttons work is actually really simple. Most of the major EMRs now have functionality because of meaningful use requirements, such that they have a feature that can be turned on where keywords are followed by a clickable link to an information resource that's defined in the configuration of the EMR. Most EMRs only allow for 1 link to 1 information resource. However, if you use Dr. Del Fiol's Open Info Button platform, that link can be sent to his server, and a number of parameters are set within the link. His server then interprets that link based on the parameters that are sent and determines the right information resources to send back to the clinician to allow them to explore a number of information resources. And by doing that, they have a lot richer information resources that they can base their decisions on.
Buttons are used to bridge gaps in clinical knowledge by providing context-specific information to the user. Clinicians use info buttons to inform their decisions on patient treatments. BMI has implemented the use of info buttons into the personal health record system by health. Each of these will be discussed further in this presentation. So, what types of questions are clinicians asking?
What types of questions are asked? Clinicians have many questions in practice. A ratio of 1 of 2 patients they see, their questions, and a mean of 10.5 questions per half-day period. Clinicians spend an average of less than 2 to 3 minutes seeking information. Dr. Del Fiol warned the reader to be cautious in the interpretation of these questions because many of those studies presented do not specify or classify the nature of the questions. So the most questions are, what is the drug of choice for condition X? What is the cause of symptom X? How should I treat such condition? What is the cause of a specific physical finding? What test is indicated in a particular situation? What is the dose of drug X? And so forth. So we can see here in this slide that the most common questions about treatment. This study include the 13 most frequent question types across studies, accounting for 80% of the questions asked and classified according to the taxonomy of Alike et al. The reference of this slide, this table is at the bottom. The article, the name of the article was Critical Questions Raised by Clinicians at the Point of Care, Systematic Review.
Medicine is an ever-changing field with rapid advances, discoveries, and changes to clinical practice and practice guidelines. Unfortunately, when physicians are faced with difficult or unfamiliar situations, the pressure to see more patients in less time makes them unlikely to seek out new guidelines or the answers to the clinical questions that arise in their daily practice. Info buttons are one way that physicians can work around this problem. They're designed to allow physicians to access the correct information at the right time and give them the information that they need to make well-informed decisions by presenting them with evidence-based guidelines and information with the click of a button. In order to do this successfully, info buttons need to provide physicians with the right information at the right time. It has to be meaningful, it has to be within the context of the practice and the patient, and it needs to be available at the correct time in a physician's workflow in order to be used efficiently and effectively. One method to improve the use of evidence-based guidelines is to provide a clinical decision support tool that allows physicians to access relevant information directly through the EHR. Conceptually, info buttons are designed to do just this. However, in practice, very few physicians are aware of their existence, and even fewer are provided with the practice and patient contextual information that they require. I've included a screenshot from Primary Children's Hospital EMR to highlight this problem. As you can see by the arrow, the lab value called protein is highlighted. This is a simple value that has multiple meanings across different practice environments. As a neonatologist, I use this value primarily to assess an infant's nutritional status and renal function. However, as you can see, when I click on this info button, I am provided with results that are specific to adults. These are results that mean absolutely nothing to me as a pediatrician or a neonatologist. Anecdotally, I can say that I was unaware that info buttons existed as a physician until I took BMI 6300. Since learning about them, I have been clicking on them regularly to see how they work. Unfortunately, I have not found an info button that has been able to provide me with information that arise to the questions that I have as a pediatrician or as a neonatologist. Info buttons are powerful conceptually, but they require further refinement in order to provide easy access to information to physicians across a number of practice environments. Until this refinement occurs, physicians in practice environments not well represented by info button results are unlikely to use them and are likely to develop a negative attitude towards their use.
This use of info buttons is unique because patients have much different needs when accessing info buttons and have much more variability in their health literacy levels. In Healy, we use over a 5-month period mountain on the continuous increase in mutation utilization of info buttons, and they are continuing to refine the data presented to patients to make them easy to understand and useful. Info buttons often link providers to pages of information about a specific topic that the provider then has to search through to find the specific points relevant to their questions. This is not always feasible during clinic visits because they are often short and clinicians want to focus their time on patient assessment or the other pertinent needs of the patient. There is also risk that the information provided by the info button will not match the needs of the provider as discussed earlier in this presentation. All of these factors increase the cognitive burden on the provider and increase the barriers of the use of info buttons.
A study by Delfiel et al. Showed that clinicians using topic-specific info buttons found their information faster than those using info buttons that linked to more general information. Both groups had similar success in finding the required information, 89.4% for those using the topic-specific and 87.2% for the generic buttons. A separate study by Collins et al. Showed that clinicians using info buttons had about a 50% success rate in seeking the answers for several generic question types. The time savings is promising, but clearly there are improvements to be made to improve the success rate of the info button users.
What do you think the future holds for info buttons and their use?
So there are several paths that I think could be further explored to improve this kind of functionality. One of them is to improve measures to improve the current adoption in today's electronic health record systems. The other path is innovations on top of this standards-based ecosystem that has been created and now is basically in place. This ecosystem includes EHR, a wide adoption of EHR systems, which is about over 90% of hospitals in the US. These are certified EHR systems that provide info button functionality compliant with the info button standard, which is required for EHR certification. It also includes a wide adoption and availability of online resources that clinicians are using in their daily routine and are also compliant with the HL7 info button standard. So there's a happy path in terms of, these things are available. People are already paying for these products. And part of the challenge now is turning the functionality on, customizing for each healthcare organization. And there needs to be efforts from that I think biomedical informatics and also medical librarians can have a lot to contribute to help with that implementation and customization effort at each healthcare organization. The other areas are more in terms of innovation. This ecosystem provides a lot, the capability to come up with a lot more functionalities or different ways of integrating online resources with EHR systems. Most implementations today are based on the idea of the I button or something similar to that. So a clinician or a patient would click on the I button and that would invoke the info button functionality. However, the info button standard and several online resources allow other kinds of interaction. So for example, you could have a little card that gets displayed on the EHR screen with some evidence that gets pushed to the EHR as opposed to the clinician having to click and find out what's available out there. We have been doing a lot of work on domain-specific info buttons, especially in the areas of pediatrics for children with special healthcare needs. We're working with the ClinGen project, which includes access to genetic information that clinicians can use to integrate genetics into their decision-making process. We're also working on a project with the CDC to leverage info buttons for things like disease outbreaks and other public health emergencies. Another area for potential innovation is to improve the way online resources present information. So right now, the info button function, typical info button approach, automates the search process. It anticipates the questions that clinicians may have, and they just run the search. So that part, we have shown that there's time savings on that part of the search process. But once they land in an online resource, the experience is essentially the same as if they would search manually. They still have to, most often, have to go through several documents. They have sometimes to scroll down several pages within a document that might have 20 pages. And the answer to the question they have might be in one sentence or one paragraph. A lot of the content in a typical document may not be relevant to their patient or to their question. So future applications could, for example, automatically mine the information in an online resource and try to figure out what is the paragraph, what is the sentence, and how can that information can be summarized and presented to the clinician so that this last mile of information seeking can be more efficient. So those are our areas that I think could benefit from further research and development, and that could be led by informatics.
Yeah, sounds like there's a lot of potential uses and applications for that.
1.
Info buttons are a brilliant concept that, if implemented correctly, could prove to be an incredible resource to time-constrained physicians. Weak evidence suggests that info buttons can help answer clinical questions. Research on optimal info button design and implementation, and on the impact on patient outcomes and provider behaviors is needed. They are also a great educational resource for patients, providing legitimate information.